I didn't realize that a spike in insulin means you're also going to crave more food, which then means that if you're the kind of person that has either environmental factors where you're eating a ton of processed food that never fills you up and is just full of stuff that spikes your insulin, that is going to become part of the cycle that you're on without even realizing that you're now trapped in this cycle and it's not your fault.
Exactly.
Wow. So what have you seen in the last 15 years since you've been using GLP-1s as a tool in your medical practice? What have you seen in terms of the benefit to patients, how this is used as a tool, the difference that it makes?
I've seen people's lives change. I've seen more acceptance to the medication. The drugs are becoming safer, less side effects. I like to compare them with the iPhone. We have different versions of the iPhone, right? We have the iPhone 1, the iPhone 10, and now we have the iPhone 16. Same is happening with this class of drugs. The versions are newer, safer, less side effects, and more effective. So I feel like people are getting the message, one, or accepting the message that obesity is a disease. They feel like giving up. For many patients, I'm the last step of their journey. And when I talk about a journey, I'm talking decades of journey. I'm talking about doing diets that I've never even heard about. I always learn about a new diet from my patients. Being with nutritionists, being in fat camps that they call them. I've seen patients struggle through their life and how this medication are changing their lives and giving them their life back, basically.
If these drugs have been around for 20 years, at least in terms of a specific treatment for type 2 diabetes, why is it that we're all just hearing about it now?
First of all, the initial versions of this drug, they caused more side effects and they were more cumbersome for somebody. People had to inject themselves twice a day, every day. So even for many patients with type 2 diabetes, it was hard to accept because patients with diabetes, they think and feel that once they're on insulin, they're failed, right? Or it's just more severe. So having a medication that is injectable, it was hard to dissociate them with insulin.
Got it.
Or with failure.
So they basically be like, I might as well just be injecting insulin at this point. Okay.
So patients didn't like to inject themselves, and it was a twice a day injection, and there were a lot of